It's the holidays, and that means a whole lot of parties, but how do you stay healthy? Joining us now to talk about that and more is Dr. Matthew Sims, Director of Infectious Disease Research at Corewell Health. Welcome, Doctor. Thanks for being with us this evening.
Happy to be here.
All right, so Doctor, what is one of the most common ways, to avoid getting sick during this time of year? I have little ones, so I feel like it's somewhat unavoidable.
There's a certain extent where it's difficult to avoid, but the single best thing we have to keep people healthy is vaccination. We have flu vaccine. Everybody should be getting it every year. We have COVID vaccines, which, while they don't always keep COVID away completely, is really important for keeping people from getting very, very sick. And now we have an RSV vaccine. It's for older people and pregnant mothers, so it's not for everybody yet. But RSV, causes a really uh, bad cough, and in older people can cause a terrible pneumonia. In younger kids, it can cause a terrible pneumonia, which is why pregnant women can get the vaccine. It's to actually protect their newborn babies. Um, Vaccination is probably the number one. The number two is, if you're sick, stay home. Don't expose other people. And the number three is hand hygiene and cough etiquette. Cough into the crook of your elbow rather than to your hands. Uh, Make sure to wash your hands, soap and water or alcohol. All of those things help reduce the spread of seasonal viruses.
And when we're having that Thanksgiving meal, everyone's kind of gathered around. People might have a few glasses of wine and let loose a little bit.
Yeah.
How do you really avoid getting sick during that time? Should we space out a little? Should we rearrange our seating?
Yeah, well, that will help. Um, Most of these viruses travel about between 3 and 6 feet. Um, but if you sneeze or cough, it can go a little further. And people are always moving around, passing each other around the table, that sort of thing. It's difficult, but you know, um, very very large gatherings tend to spread things worse. More people, more chance that any one might be sick. So smaller family gatherings might be better. Um, there was a point when COVID was really bad. People were suggesting keeping the windows open for good airflow. Difficult to do in the cold weather, but people have done that too.
And Dr. Sims, one thing I often think about also is travel. People are going to start traveling by plane, train, public
Yeah,
transportation, and masking restrictions they've eased. But is that something you would suggest doing before you hop on a flight? Maybe having a mask in your pocket or
yeah.
something to throw on?
So when I fly, I always wear a mask. Actually, I still wear masks in crowds. About the only time where I'm with people where you won't see me in a mask is if we're eating. You can't really wear a mask and eat. But when I go on a plane, I usually wear an N95 or a KN95. Um, when everybody was masking, a surgical mask was good enough to protect people because everybody who was wearing a surgical mask was protecting everybody around them. They didn't protect themselves with the surgical mask, it was everybody else's surgical masks that protected them. So now, if you really want to protect yourself with a mask, you really need to wear a higher quality mask, a KF94, a KN95, or an N95. Though N95s, really need to be fit well and are more difficult to wear for longer periods because they're very tight to the face. So I usually suggest a KN95 or a KF94.
And let's talk about the numbers. Any idea how many people on average get sick around this time of year? And do you expect those
Yeah.
numbers to increase?
Yeah, lots of people get sick right around Thanksgiving. I know that the CDC just recently released some data that there are 7 states where flu is really really on the rise, and several others where it's rising significantly. Even here in Michigan, we know it's on the rise. Our numbers are going up week to week, and right now, we're running. We're seeing flu, we're seeing RSV, and we're still seeing COVID. Um, all of those are going to get worse probably as the winter progresses. And depending year to some years, a year, I think it was last year, we had a big RSV outbreak right around this time. It was, burying us in patients, and COVID is never really stops. We always have some COVID; it just goes up. Um, and flu, some years it's just incredibly bad. That's why the vaccines are really so important, because even if you have a breakthrough case where it gets through the vaccine, you're generally much less sick.
Hmm. And you talked about getting vaccinated. We know some people haven't or refuse to. How do we protect ourselves against those who aren't vaccinated if we are vaccinated?
Yeah, so if we're vaccinated, we're already doing some to protect ourselves, right? But it's difficult. Um, some places vaccines are, if you work in the healthcare system, you're pretty much mandated to get flu vaccine. At one point, it was mandated to get COVID vaccine, and now that sort of has fallen by the wayside. The RSV vaccine is new. This is the first season it's available, and as I said, that's only for older people. But again, to protect yourself, it's a matter of, if you see somebody who's, actively sick, if you know one of your family members is actively sick, you might have to say, maybe you should stay home. We want to see you, but and you can do things. I remember during COVID, for family dinners, sometimes we got Zoom up and running, and we had an iPad there, and we were broadcasting so that people could be connected even if they weren't in the same room. So that's the biggest thing: is if somebody is sick, they really shouldn't be there for the celebration.
Yeah, Zoom is always a great alternative. Well, Dr. Matthew Sims, Director of Infectious Diseases Research at Corewell Health, thank you for joining us.
Happy to.